Good evening, everyone, and thank you for joining today's webinar presented by Northwest Clinic. Today, we will be talking about diabetes care in Ramadan. Now, before we start, I'd like to tell you a little bit about Northwest Clinic, which was founded in 2009. Its name was derived from the fact that Dubai is in the northwest of the UAE. Some of our consultants have lived and trained in the northwest of the UK and moved from mountains in northwest of Pakistan. Hence, a few of us seem to have a natural propensity with Northwest wherever we go. We strive towards creating bonds between our patients and our families with our medical experts and professionals. We provide contemporary and evidence-based medical practices, and we are committed to help, guide, and provide information related to services which we may not be able to directly support. Our ethos is very much focused around treatment with love and care. Our services are very wide-based, and we have a multitude of subspecialties in this clinic, and we really aim to provide you with A to Z service with holistic care in this clinic. So why will we be talking about diabetes care in Ramadan? So the International Diabetes Federation of the MENA region currently has the highest age-adjusted diabetes prevalence of all IDF regions, approximately at 12%. The MENA region has a high and growing Muslim population as well. Now, there are many physical, spiritual, and mental benefits of Ramadan: the opportunity to self-respect on aspects of life that need improving, the ability to grow spiritually through prayers, and the chance to spend more time with loved ones. However, when a patient with diabetes undertakes the practice of Ramadan, there are also many changes that are happening physically within the body, such as changes to eating patterns, glucose excursions, sleep deprivation, heightened anxiety about diabetes-related complications, changes in weight, short-term feelings of stress. So diabetes education classes have really been shown to help improve healthcare parameters in individuals with diabetes during Ramadan. So our aim is to help you improve and control your blood sugar levels, improve and control your weight, your BMI, allow you to have a greater ability of self-control and ability to resist temptations, improve your mental and physical well-being, and participate in sunnah practices for the greater spiritual benefits. My name is Dr. Aarti. I'm a specialist in internal medicine with 8 years of practice in medicine. I have a board certification in lifestyle medicine, and that's where my special interest lies. I'm the global ambassador of the Lifestyle Medicine Organization in the UAE, and my special interest lies within lifestyle medicine, weight management, diabetes, PCOS, thyroid, and general medicine. So today we will be having 3 speakers: Dr. Zia, who will be talking to us about glucose regulation in Ramadan; Dr. Zain, who will be talking about medications during Ramadan; and our nutritionist, Mithun, who will be talking to us about nutrition in Ramadan. Each of these speakers will be speaking for about 10 minutes. And if you have any questions for the speakers, if you can post your questions in the chat box, we'll have 20 minutes at the end of all 3 speakers for you to have an opportunity to be able to ask questions. And then the panelists, Dr. Zia, Dr. Zain, and Mithun will be answering your questions. So without further ado, let me introduce our first speaker, Dr. Zia. Dr. Zia is a consultant in internal medicine and endocrinologist. After acquiring membership of the Royal College of Physicians in London, he received further training as a registrar and senior registrar in endocrinology and internal medicine at teaching hospitals in and around Manchester, UK. Dr. Zia was then awarded to be the specialist registrar in the GMC UK, and this enabled him to become a consultant physician in endocrinology in 1996. Dr. Zia served mostly in the northwest of England until 2007, after which he moved to Dubai. Initially, he worked at Medcare Hospital since April 2009, and he's been practicing at Northwest Clinic since 2009. Dr. Zia has a wide range of interests, including diabetes, insulin resistance, diabetes and pregnancy, thyroid problems, pituitary, adrenal, ovarian, and testicular hormones, growth, fertility concerns, as well as blood pressure and weight-related problems related to hormones. Today, Dr. Zia will be talking to us about glucose regulation in Ramadan.
Hello, Assalamu alaikum, everyone. Thank you very much, Dr. Aarti, for your introduction of both yourself, Northwest Clinic, and me too. So we are talking about Muslims fasting in Ramadan in this webinar. And I'm going to be giving a short and brief talk on the matters related to glucose levels. Many patients in Ramadan insist on fasting despite them having diabetes. And sometimes, majority of them are okay, but sometimes this does create a medical challenge. Thus, familiarity and knowledge for such patients, their families, and healthcare professionals is very important. Worldwide, about 50 million Muslims fast during this month. The total population of Muslims in the world is about 1.8 billion, out of which there is an estimated 100 million Muslims who has diabetes, and about half of them fast during Ramadan. Now, those who does fast, about 80% of them has type 2 diabetes as being the most common type of diabetes. But even with type 1 diabetes, about 40% or more fast too. Some studies, particularly the one in this part of the world, has revealed that up to 86% of Muslims who fast and has type 2 diabetes, they fast for at least 15 days. Hence, looking at these big numbers among the diabetes population of Muslims who are fasting despite maybe sometimes their doctors may not want them to fast, it is very important practice, and it does have a major impact on the management of diabetes during Ramadan. During the fasting period, there is a tendency of low blood sugars, and this goes up by about 4.7 times in type 1 diabetes and by about 7.5 times in type 2 diabetes, the risk of severe hypoglycemia. So what are the features of hypoglycemia and how would we know that I have hypoglycemia? The common symptoms, some of them or all of them can occur, can be palpitations or fast heart rate, numbness or tingling of lips, a generalized feeling of anxiety that may be causing some blurring of vision too, and sometimes one can even notice a tremor or a shake in their hands and start having cold sweats as well. Generally, when the blood sugar drops, there are certain hormones in our body which would rise and keep us going. And these hormones are mainly glucagon, which is also produced by the pancreas, adrenaline, or also being called epinephrine, that comes from adrenal gland, and that helps to maintain our blood sugar levels, and also steroids. Now, in the background of diabetes, sometimes some of the patients may have been taking long-term insulin, or they may have neuropathy, which can blunt the rise of these hormones, and such rise or the natural support that the body has may not occur. And hence, the drop in blood sugar levels or the hypoglycemia can occur and can be severe as well. While we are afraid of hypoglycemia during the fasting period, and the day can be quite long, up to 14, 15 hours, or even more longer in some parts of the world, we can have high blood sugars as well. The reason for high blood sugar, as we know, is diabetes itself. And particularly if we are not taking our regular insulin and tablets during the day, then there is already a lack of insulin, which leads to high blood sugar. But this prolonged fasting does reduces further the insulin in the body, and this can cause high blood sugar. And as most of you would know, that when the blood sugar goes very high, then that can cause a medical emergency called ketoacidosis, which means that the body has started breaking down perhaps muscles to get energy, which then create ketones. Severity of hyperglycemia depends on the extent of insulin resistance and its deficiency, lack of insulin. So now a few numbers to share that when should we really be worried about our glucose levels? One important message is that we should be regularly checking our blood sugar during the fasting period, and particularly if we feel any of the symptoms that I already outlined. So by definition, hypoglycemia is blood sugar level less than 70 milligram per deciliter. It's very important to know the risks of hypoglycemia and keep checking your levels. On the other hand, hyperglycemia can be risky and really worrisome if your number is above 300. Hence, we should not delay at that stage seeking help and also seeking professional help. Now, both of these numbers are recommended for hypoglycemia less than 70 and hyperglycemia above 300 to really break the fast. So we need seeking more advice and discussing our individual situation to seek to share with our professional doctors and nurses or whoever is the member of team helping you about our routine, about nutrition, fluids, medication and dosages. And we should be flexible in if we decide to fast, that if needed, we should not hesitate in breaking the fast and report immediately to for help if you feel unwell. So thank you very much. And I will now hand over back to Dr. Aarti to take it further. Thank you.
Thank you so much for that talk, Dr. Zia. It was very informative. Now we will be talking, Dr. Zain will be talking to us about medications in Ramadan. Dr. Zain has obtained his internal medicine and endocrine fellowship in New York. He's a consultant endocrinologist. Before arriving in the UAE in 2007, he was an associate professor of medicine at the University of South Texas and had a busy endocrine private practice in Texas. He has over 15 years of experience. His special interest lies in diabetes and thyroid disorders. He has an extensive experience in insulin pumps and continuous glucose monitoring and management of all types of diabetes and its complications. He serves as an active member and fellow of the American Association of Clinical Endocrinologists and has the certifications in neck ultrasonography and insulin pump therapy. So without further ado, Dr. Zain will be talking to us about medications in Ramadan.
Thank you very much, Dr. Aarti, and thank you for the kind introduction. Thank you all the participants who have are spending their precious Saturday with us. I'm going to have a brief talk about the general aspects of different types of medications in diabetes. I will try to, this topic can be quite complex and complicated, and I'll try to see if we can make it a little bit easy to understand. But if there is any doubt, then I'll be able to. We'll try to be able to clear it in the question and answer session. So here is a general outline of the types of diabetes medicines that we use. And they are basically divided into orals and injectables. Um, Now, what I've done here is that I have sort of color coded these medications into medications for oral medications for diabetes that can cause hypoglycemia, and other oral medications that don't cause hypoglycemia. Certain types of injectables um, that don't cause hypoglycemia. And of course, injectables like insulin, which cause hypoglycemia. So we go over this in a little bit more detail to see what types of medications uh, does what to your blood sugars, and how one can sort of uh, get overview of whether or not um, fasting may or may not be a challenge. There are certain medications for diabetes that absolutely cause no hypoglycemia. And people who are on these sort of medications can just go about their normal day and just fast as long as they want without any issues to their blood sugars. On the other hand, there are other medications, like for example, on the top line, you see this group of medications called sulfonylureas. They are extremely common part of a diabetes regimen. In fact, in the approximately, I would say, five years ago, almost every person who had diabetes, or almost every person, was taking one of these sort of medications. And the common names of these medications, which one might be familiar with, is dimicron or Amaryl or Divita or Daonil. These are the older generation diabetes medicines, and they lower blood glucose very effectively, but they have the tendency to lower blood glucose even if it can do harm. Now, other than lowering blood glucose, there may be medications that don't lower blood sugars but can cause dehydration. And that's why I've sort of color coded these in red, amber, and green. These medications, this group of medications, are called SGLT2s. And they are also now, they are a newer generation medication. They are fairly commonly used in diabetes, but one of the side effects is that they may cause dehydration. So it is not that one cannot fast while one is taking them, but one has to be careful. One has to make sure that dehydration is maintained, and that the timing of these medications may need to be changed in Ramadan. In the last group, there are medications that don't cause any effect on hypoglycemia. They are very effective in lowering blood sugars, but these medications are called glucose-dependent hypoglycemic agents. Means that once the blood sugars are normal, they will not lower it anymore. So these are very smart medications in the sense that they will lower high blood sugars, but they will not have any effect on blood sugars that are normal. So common examples of these are the oldest medications available, which is glucophage. There is this other medicine, which is now not that commonly used, called glucobay, Januvia, Genomed, Galvesmet. I mean, there are quite a few different names, and I've just picked up a few. It might strike some sort of familiarity with some of our listeners. Now, one thing that one has to be careful of, if you have a medication that is in this class, which is a medicine which is glucose dependent, which does not lower your blood sugar, but you are taking it alongside another medication, which is a sulfonylurea, then the effect of that safety net from the medication is lost. So let's say that someone is taking glucophage by itself and wants to fast, no problem. If one is taking glucophage and Januvia, wants to fast, no problem. But if one is taking glucophage and one of the medicines from the first group, something like Amaryl, then yes, this one, the top group, is going to have an impact on lowering the blood sugars, even if this is just part of the regimen. All right, so having said that, let's go to the injectables. So in this group, you can see that there are these groups of insulins and non-insulins. Now, what I mean by non-insulins are that these are the newer diabetes injectable medications. They are called GLP-1s, and they have a very effective glucose lowering effect, but does not cause hypoglycemia. And that's why I put them all in the green column. And they are, the commonly used ones are Victoza, Ozempic, Byetta, or Trulicity. Now, when you look at the insulins, there are three groups of insulins. There are the long-acting version, there is the short-acting version, and there is the mixed version. The long-acting version is is a very slow insulin, so it doesn't have any immediate glucose lowering effect. The effects usually starts within 6 hours and can last between 18 to 36 hours, as in this top insulin, which is Tresiba. So that's why I put it in this amber column, where these can lower the blood sugars, but it is possible to sort of adjust the dose of this medication and do it in such a way that one does not get low blood sugars during the day. Now, example of these long-acting insulins are Tresiba, which is very commonly used, Lantus, another commonly used, Basaglar. And then there are these other combination medications such as Zaltofi and Soliqua, which are combinations of these long-acting insulins and the GLP-1s. So they have been sort of mixed together. Again, I will reiterate that if one is taking a long-acting insulin by itself, then it is workable. There isn't that much of a problem with hypoglycemia. But once these are combined with other medications that can cause low blood sugars, then that hypoglycemia safety net is sort of lost. Now, there is another group of these insulins which are short-acting medications, short-acting insulins. And examples of this is Novorapid, Humalog, Apidra, and the older versions called Actrapid and Humalinar. Now, these insulins work fairly rapidly, and their job is to start working within an hour of getting an injection. These insulins are very notorious for causing low blood sugars. And the only reason why they don't usually cause low blood sugars is that the person will have another meal before that low blood sugar, that hypoglycemia gets time to set in. So when one is fasting, especially at sahur time, and this insulin is taken, then there is a fair amount of risk of the blood sugars dropping in the early, by afternoon time. And since that safety net of meal is not allowed at that time, the patient can run into problems. So one has to be very careful when they are on these types of insulins. Other type of insulin that can also cause these hypoglycemic effects are the mixed version of insulin. So these are Mixtard, Humalog Mix, Novo Mix, and these are also a combination of intermediate and short-acting insulins, and they are also quite notorious in causing low blood sugars. So in summary, I would say that certain diabetic medications do not cause hypoglycemia. However, when these medicines are used in combination, then that benefit may be lost. The next point is that in addition to hypoglycemia, other side effects of medications should be considered, such as dehydration. The third point is that a previous, for any individual patient, a previous Ramadan experience may help to gauge the need for change. So if one has had a bad experience the previous year, then that will sort of tell you what you are in for and whether or not you need to be careful this year, especially if the medications have not changed. If the medicines have changed, then of course all bets are off. And finally, I would say that every person's individual risk factors are unique to them, and their diabetic medications are personalized to fit their needs. So this is very important. Each and every patient has certain risk factors that may or may not be dangerous or detrimental to their health if they fast. So let's say that someone has underlying kidney problems and it is unsafe for them to go without water for 16 hours. Then that person has to see whether or not what are the risks and benefit, and has to consult with their physician in order to discuss the diabetic regimen to see whether or not they can safely perform these fasts. Having said that, one should be ready to break their fast if there is some if it turns out that it may harm their health. For example, let's say that someone's blood sugar has gone down and they check their blood sugar and it's down to 70, and it's still 3 o'clock in the afternoon. You have another 4 hours to go. Now, I would not recommend anyone risking to see whether or not they can pull it off, because once the blood sugar starts falling, then it might be quite difficult, and one might lose their sense of comprehension and judgment in order to protect themselves. So one must always be ready to break the fast and maybe go over and see where it is or what can be done, or speak to their physician, and then have another go at it if they must. Thank you very much, and I will pass the podium back to Dr. Arti.
Thank you so much for that, Dr. Zain. It was very, very informative. We do have a question in the chat box, but I will attend to all these questions at the end of the session. If you do have any questions, please put them in the chat box and we'll discuss them after the next session. So next up, we have Mithun, who's going to be talking to us about nutrition in Ramadan. Mithun has completed her post-graduation in nutrition and dietetics from SNDT University in India in 1999. She has over 11 years of post-qualification experience in dietetics, and she's gained experiences from multiple renowned hospitals in India. She's pioneered as a chief dietitian and of MD Simply Health Weight Management, and she has a diet meal delivery service in Dubai. Her special interest is in weight management, lifestyle modification, diabetes, kidney and heart disease, food intolerances, pregnancy, and lactation. She loves doing workshops and seminars for corporate schools and charitable organizations to raise nutritional awareness, and she has a wide range of understanding of different cuisines ranging from Arabic, Indian, Pakistani to continental tastes. So without further ado, here's Mithun, who's going to be talking about nutrition in Ramadan.
Thank you, Dr. Aarti. A small correction, it's 21 years of experience, not 11 years. I joined Northwest Clinic in 2010. So if you make the calculation, it's 2021.
I apologize. Sorry for that.
No worries. Let's come straight to the point, a very crucial topic, nutrition. It's overwhelming to understand and decide what should I be eating during Ramadan. So let's begin with the most important topic, which I feel being in this profession of nutrition. So how do we break our fast? Of course, traditionally, we've been breaking our fast with dates, but what is the main reason? The reason is after 15, 16 hours of fasting, your blood sugar is low. And that's a time when you need an easily available source of energy in the form of glucose. And this helps in also bringing your low blood glucose to normal levels. It's high in potassium, the dates are high in potassium, magnesium, calcium. It's also high in fiber. So it satiates you just about a couple of dates, 2 or 3 dates, and you feel satiety, and the fiber, the beta-glucan, makes you feel full. And that's why we eat dates. So just a couple of dates, a glass of water, or some water with, just some lemon, some salt, or a glass of laban is enough to just open your fast or break your fast. But what do we do usually? The women of the house make a feast. So fasting becomes feasting. So again, that's very traditional. So you have a huge spread. You see samosas, you see spring rolls, there is chaat, there is everything, all the goodies, and it can be tempting. But is this what we should be eating? I think you all know the answer. No, we cannot begin with disturbing our digestive system by eating such heavy, greasy, sugary, fried food. So what should be the ideal diet? Like I said, first you're going to start your diet with, you're going to break the fast or open the fast with dates, maybe a glass of laban, because the yogurt will give you all the necessary good probiotics, maybe a glass of lemon with just a pinch of salt, because you need a jolt of those electrolytes coming from the lemon, from the salt, or maybe sometimes you can just squeeze in or blend in a good vegetable juice, which will have different kinds of green vegetables like cucumbers, which is high water content, has good amount of potassium. You might add some spinach, some kale, some green apples, and have something like that to hydrate your body. Do you think we should encourage you to drink the sharbats and the sugary drinks? Maybe not. I would rather that you have a glass of coconut water instead of having a fruit juice to open your fast. Okay. Followed by, I always encourage my patients that why don't you have a bowl of soup? And when I say a bowl of soup, it doesn't necessarily only mean vegetables. I encourage them to probably boil the soup with some chicken bones or meat bones, because the collagen from the bones can improve your gut lining, it can improve the gut microbiome, it can, it provide all the necessary nutrients, the collagen that it can provide. And also, of course, you need to add lots of vegetables to it. So you get a lot of fiber again, and again, a jolt of electrolytes that we talk about. So a good bowl of soup, and maybe you can combine with some crackers, some wholemeal crackers, or a piece of toast. And if you don't want to eat a piece of toast or cracker, the vegetables also give you a good source of fiber and enough carbohydrates. It's important that you go slow and don't eat a very heavy iftar. As you go slow, you're actually letting your digestive system stimulate the digestive juices, and it makes it easier for you to digest your food. All right, so how do you make your combination of the meal? So once the dates are done, once the coconut water has been had, you've had some fluids, you've had a little bit of soup, a little bit of cracker. Now you're going to eat the main meal, for example, that is after the iftar, the small meal that you will be having. Now this has to be a very balanced meal. So this should include some carbohydrate, this should include some protein, some fiber, and some fat. So here are some examples. Let's say you create a wrap for yourself. It could be a wholemeal wrap. It could be a homemade bajre ki roti. It can be just a wholemeal bread, and you stuff it with lots of vegetables. You stuff it with some protein from chicken or meat or fish or some eggs, and some fat coming from maybe some avocados, or maybe you've used some olive oil in your cooking. It can also be that you've used some brown rice. So it can be a dish that is made with brown rice, with some chicken and lots of veggies. It can be quinoa, it can be couscous. So this is an example. They do not just have plain carbs, but combine it with your proteins, combine it with fiber, combine it with fats. So let's talk about some healthy carbohydrates that you can include in your iftar. So let's say brown rice. There can be wholemeal rotis, like I spoke about, wholemeal kubus, pita, wholemeal pastas if you like pastas, bulgur, broken wheat, quinoa. You can even try millet. And the proteins would be in the form of lean chicken, skinless fish, lean beef. Once in a way, we don't mind you having some lamb, but avoid red meat as much as you can. Some chickpeas, some beans, lentils, tofu, cottage cheese are all good sources of protein. And when I say fiber, I'm talking about fiber, vitamins, and minerals and nutrients coming from different kinds of green leaf vegetables, lots of different colorful variety of other colorful vegetables. So just make a rainbow. Make your plate more green than brown than white. Okay. And you also need to include some fats. Fats are not your foes, they're not your enemies. You have to include some good fats when you're combining your meal. And these fat should ideally be coming from nuts and seed-based fats. So let's say it could be olive oil, it could be flaxseed oil, avocado oil, coconut oil, but fat should always be in moderation. You cannot overdo on fats, remember that. 1 gram of fat is 9 calories. So you can imagine the more fat you add, the kind of calories that you will be pumping into your diet. So peanut oil, mustard oil, groundnut oil, a little bit of ghee. So these are the combinations that you can use, but probably in one meal, you should not exceed more than a teaspoon of fat. Okay, can I have a second dinner? Many a times people have this iftar and they tend to just eat that meal. I would rather that you spread out your meals. Don't pump yourself with a big meal just at iftar. You take a meal at iftar, then you probably pray, take a break, go for a walk, and then somewhere later around 9:30, 10, 10:30, you can have a smallish meal again. And this meal could go easy on carbs. So you could focus more on good quality fatty fish, like having some salmon or having some tuna or the local fish that you get here. Sherry is a good fish. You get Sultan Ibrahim. There is mackerel. You get sea bream. You get sea bass. The different kinds of lean fish that you can have. You can have a grilled piece of chicken. With that, you load up on veggies. You load up on salads. Have some guacamole on the side and hummus on the side. So this can be your carbohydrate. But don't try to avoid late night eating rice or bread or rotis or potatoes. So this can become your second dinner. And if you're sleeping late, of course, you might get hungry again. So first and foremost, try not to sleep late, try to get to bed on time. But if you have to, if that's how you have been, that's how your lifestyle is during Ramadan, then yes, a little bit of snacking is also important. So you could, instead of going and having desserts that you see on the table, you probably could have healthier snack options coming from nuts and seeds. So you could just keep on the table a handful of almonds, pistachios, walnuts, little bit of chopped dates or prunes, actually, figs. So these kind of small little snacks are better than having a dessert. Or you could have a good Greek yogurt or a low-fat yogurt, sprinkle some flaxseed, some berries. So these give you good tryptophan. Now, tryptophan is important for serotonin to be released in your brain, and that relaxes you, it reduces your anxiety, and it induces good sleep. All right, don't forget hydration. Hydration is key. Drinking water is more important than foods. Keeping your cells hydrated, keeping your body hydrated is more important. You can live without food for a couple of days, but you cannot stay without hydration. So remember that you, from iftar until the next suhoor meal that you're going to have in the morning, keep on sipping water. Try to include at least 2 liters of water during the eating window. Why is suhoor the most important meal of the day? I think all of you know this answer. This is the meal that's going to decide how your day is going to be productive. Will you be suffering with headaches? Will you have energy? You will be fatigued? Will you be sleepy? Will you be irritable? Will you have low energy? Will you have low blood sugar? So everything will decide this meal decides how your day will be, how productive you will be. So it's important that you eat the right nourishing meal at this time. And I always believe in ensuring that you combine this meal with good complex carbohydrate, again with your protein, fiber, and fats. So this is something that you have to keep in mind if you're a diabetic and if you're fasting during Ramadan, that each of your meals should be low in glycemic index. So when you have the right combination of these foods, your glycemic index of that meal is low. So let's say your carbohydrates could be oatmeal, it could be a good low sugar muesli, a wholemeal pita bread, a wholemeal bread, quinoa, bran rotis. Again, very similar, having high fiber breads and carbohydrates. And your protein sources in the morning can be eggs, it can be low fat dairy like yogurt, can be beans, chickpeas, lentils, adding some fats like avocados, nuts, and seeds. Yeah, so these are the kind of foods you can combine with. So let me show you an example. I'm a big fan of oatmeal. So having a nice steel cut oats that's mixed with chia seeds, added some nuts and seeds for the fat and fiber. And as long as you don't add any sugar to it, you can add some low-fat milk, you can add almond milk, you can add coconut milk, you can throw in some berries and throw in some fruits, and this can be a good, wholesome, high fiber that keeps you full, releases your glucose into your blood cells slowly. So that kind of a meal is what you're going to have in the morning. Or you could have some eggs with some wholemeal bread, and you could add some broccoli, you could add cauliflower, green beans, bell peppers, mushrooms. So there are so many different vegetables that you can add to your protein meal and ensure that you are full and satiated until at least afternoon 2, 3, and you don't go get those hunger pangs. All right, what about tea and coffee? Of course, we're all addicted to our tea and coffee. So I tell my patients a month in advance to go easy and slow on their caffeine. We all know that caffeine can be dehydrating. The more tea and coffee you drink during this eating window, you're going to be dehydrated, you're going to be thirsty. And also what happens is excessive amounts of tea and coffee can also hinder the absorption of nutrients in your body. So if you have a cup of coffee and you're eating fruits along with it, it's of no use. You're not absorbing the vitamin C from that fruit. So ensure that probably you could have 1 cup of coffee somewhere in the morning at suhoor, and the next can be probably at iftar, but not too many of them, because we don't want that caffeine to dehydrate you. All right, and like I was saying, that sometimes a month in advance I tell my clients to start reducing their intake of caffeine, because they tend to have migraines, they tend to get withdrawal symptoms, and they often complain that we can't do without our tea and coffee, and they come back to us with migraine issues. So yeah, and very importantly, suhoor is the time when you will actually chug down as much water as you can, because you need that hydration. Now it's going to be 15 hours without hydration, without water. It's not like a regular intermittent fasting, because when you're regularly intermittent fasting, you are allowed to have fluids, but in Ramadan, you're not allowed any fluids. To remember that. All right. So we all love our biryani with a glass of Coke next to it, but are you allowed to have diet sodas and diet Cokes, diet Pepsis? Well, ideally no, because the aspartame again will give you headaches, it will give you migraines, and also we know that continuous consumption of these diet sodas will deplete calcium from your bones, making your bones brittle. We've also seen studies where you lose focus, you lose concentration, and you really don't want to get into this habit. So Ramadan or no Ramadan, we need to stay away from all the diet sodas. Can we exercise? Many times I get this question asked. Now, sometimes we get these patients who suddenly are very excited and enthusiastic about losing weight during Ramadan and starting this whole weight loss journey, or starting an exercise routine. Now, if you have an exercise in your life, this is not the right time to start an exercise program, okay? But if you have been exercising regularly and you don't know when to fit it in, then the ideal time would have been, I would say, 30 to 40 minutes before iftar sets in, or maybe after a smallish iftar, you go for a little exercise post iftar. Or sometimes some people also ask us if they can exercise before suhoor. Now that depends what your lifestyle again is. I mean, are you going to wake up at 3 in the morning to exercise and then eat your suhoor meal? So that might not be very practical. So the best time to do a smallish exercise, but listen to your body. You don't want to be fatigued. You don't want to have low blood sugar, low BP, and still exercising because you are in this mindset of losing weight. So don't try to do anything out of the ordinary. Listen to your body, very importantly. All right. So here it is, a little summary of the best time to exercise or weight training workout is not while you're fasting. It will be more detrimental than being beneficial. Weight training after prayers or after an hour after iftar to ensure you have some fuel and hydration before you hit the gym. And short, intense 30 minutes workout instead of long hours, and a light cardio before suhoor meal or iftar for 30 minutes. So a few tips now to club it all together and summarize. Always wake up for suhoor and eat a wholesome meal, as this meal will decide how your body functions smoothly by delaying hunger pangs and not dropping the body temperature, blood sugar and blood pressure considerably. Eat complex carbohydrates and good quality protein and fat, especially at suhoor. Have a very light iftar and then you follow it up with a wholesome dinner. Try avoiding overeating at any meal times is very important. Avoid too much tea and coffee as they can dehydrate you. You need to avoid getting migraines and other withdrawal symptoms. You may start reducing your intake of caffeine a month in advance to prepare your body. And you have to ensure that you drink plenty of water from iftar until suhoor to avoid dehydration. And also a very important tip is to avoid greasy, spicy and sugary foods to avoid indigestion and acidity. Ensure you get enough sleep. We compromise on our sleep a lot during these times. So sleep, rest well, avoid sugars, avoid sweets and desserts if you can. If you're tempted by desserts, then don't deny yourself, but just eat them in moderation. Have homemade fresh food, fresh fruits, vegetables as much as possible, and adjust your medications as Dr. Zain and Dr. Zia suggested. Adjust your medications and keep a check of your blood sugar levels. Thank you very much.
Thank you so much for that, Ms. Mithun. So we have time for question and answers now. So if anyone has any, please post them in the chat box or in the Q&A box. We do already have a few questions. Dr. Zain, this question is addressed towards you. What should be the best time for glucophage during Ramadan?
So glucophage is a medication that actually does not lower your blood sugars. So if you are taking the extended release version of glucophage, ideally it should be after a meal. Historically, the best time that most people would take it would be after dinner. So, if one has been taking it in the morning, I generally tell my patients to switch the morning medications to iftar time. So, because that's your breakfast basically. So iftar, after generally most of the medications such as glucophage can be taken very safely after iftar.
Okay, thank you for that. The next question is for Ms. Mithun. How do I avoid acidity after suhoor, since the body is not used to eating so early in the morning? Any tips on how to help avoid it?
Yes, it is quite bound to happen because we're not used to waking up at 3 or 4 in the morning or eating late dinners, sleeping immediately after our meals because you have to get to work, and then that is bound to happen. So you have to watch out. First and foremost, I think most people don't chew their food well. They are always in a rush and they try to gobble down the food. So it's important that you digest half the food in your mouth. A good mastication in the mouth is important. So you digest the food, then it gets into your gut, and then the digestion process becomes easier. Many a times we talk and we eat and we're swallowing air, and that also causes a lot of bloating, can cause heartburn. And third thing is, I feel very importantly, is like I was saying, you eat late night meals and then you lie down. There is no movement, and in the morning there is a lot of undigested food in your gut, and there is acidity, and then some people are kind of intolerant to certain foods. So you need to watch out if you're intolerant to certain dairy products or certain gluten-based products or beans or lentils when you eat at night. Does it cause indigestion? So these things you have to watch out for. You have to listen to your body, write down the symptoms, when you ate what and how did you feel. And there are some ways you can beat the bloating and the acidity is keep some ginger in your mouth, maybe after suhoor immediately, and that is during the eating window. And for example, you have liquids of water that is boiled with ginger, maybe cumin seeds, maybe fennel seeds, adding some parsley to it and drinking that kind of infused water, chamomile teas. All these things can help in reducing the acids and keeping a soothed gut as such.
Thank you so much for that. Dr. Zia, the next question is directed towards you. If I do get a hypoglycemic episode, how should I break my fast?
Right. So basically, there can be two ways of finding out that you have hypoglycemia. One is the symptoms. And if you think you have hypoglycemia, we still advise, if possible, you should check your blood sugar levels. And depending on those levels, if, as I said earlier, if your number is 70 or less, then you should very seriously consider and break your fast. That's very important. Now, how should you break your fast? Again, one would presume that you already know how to deal with hypoglycemia. If not, then it's also suggested that before Ramadan starts or during even Ramadan, you can communicate with your diabetes team to know more about it. What we advise is that you can break your fast with some juice, fruit juice, or even dates, or even you can have something sweets, whatever is available to you. We do recommend that not to overeat or overdo that. Allow some time for your symptoms to settle and recheck your blood sugar levels in about 30 minutes to 60 minutes again. And if those numbers are settling or coming up, then hopefully you may not need to have anything more, and you should be starting feeling better. Again, if the numbers are dropping further, then you need to assess that you can have something to eat again, or even seek medical attention in a clinic or a hospital setting.
Thank you so much, Dr. Zia. Dr. Zain, one more question for you. Is it okay if I stop my medications if I'm fasting?
So generally the answer is no. For diabetes, one is usually on not just one type of medications, but a whole combination of medications. The way that these medications are designed to work in someone who has been well controlled with diabetes is that a whole lettuce is made from from different medications, each working, each doing its own part in controlling the blood sugar by different mechanism of actions. So even if you stop one of these medications, it can sort of destroy that whole complex that these medicines have provided as a combination. So no, it is not okay to stop the medicine. What I would definitely recommend is to talk to your doctor. It might be possible to change one medication into something else. It might be possible to adjust the timing of the medication. It might be possible to reduce the dose of the medication. So there are multiple things that can be done, but always with the advice of the physician. I would not advise patients to try and do it themselves, because there is a risk that it may or may not work. If it does not work, then it might actually be harmful.
Okay, thank you so much. Ms. Mithun, one more question. Can I just have one big meal at iftar? I don't like to eat often.
Yes, many a times clients don't like to eat very often. But you see, when you're going to eat a very large meal as the first meal after 15, 16 hours of fasting, you're going to actually have an impact to how your food gets digested. You might suffer from heartburn, you might suffer from acidity, and also the fact that you really can't get all the nutrients in one meal. It's better to spread it out. So if you ask my recommendation, I would definitely not recommend that you have just one meal. The first meal has to be small, more liquid based, more vegetable foods with high water content, and slowly you have to spread it out and then have a second meal. So just one meal is probably not advisable. You also need to check your blood sugar levels impact. It can have the kind of spike that you can have in your blood sugar levels after that one large meal. So that might also be something you would like to consider if you're a diabetic. So my recommendation is no, you should not have just one large meal.
Okay, thank you so much. Dr. Zia? When should I check my blood sugar levels if I'm fasting?
Right. So again, it's very important and very good to check your blood sugar levels and keep yourself informed of how your diabetes control is during the fasting period. Usually, you should check before you eat, but during the day, let's say once in the morning hours at least, and once in the afternoon, and also then before an hour or so before you're about to reach the iftar time. So on average, if you do it a few times even, you don't have to, depending on your control and the advice of your diabetes care team, you don't have to check it every single day, 5 or 6 times a day, but at least on different times and different time of the day, you can have a pattern during the week. But it's very important to keep checking yourself and making sure that you are within the desirable range agreed between yourself and your doctor.
Okay, thank you so much. I think that's all the questions that we have. Okay, we have one more question. Dr. Zain, how reliable are Holcomb meter?
I'm sorry, which meter is that?
Holcomb.
I'm not sure whether I'm familiar. I mean, if it's a glucometer that has been used with by taking a sample of blood and checking it, most of these meters that are available in the market are quite reliable. There are different types of meters, though. There is the meter that you would that uses a sensor. So it's a sensor-based meter called a Freestyle Libre monitor, where you would attach a sensor on your arm and then just flash your mobile phone against that sensor. And that also has been shown to be about 97% accurate. So as far as glucometers are concerned, most glucometers are very accurate, unless there is a problem with the strips have expired, or the battery is failing or something like that. Most meters, I would say, are quite accurate.
Okay, great. Thank you so much. Sorry, one more question. This is a bit personal, but it's Dr. Zia, if you can answer. It says, I'm taking Janumet XR 1000 mg twice daily and Forxiga 10 mg once daily. How should I take it in Ramadan?
Sorry, I got the Genumet dosage, but what was the other drug?
Forxiga 10 mg once daily.
Right. So I think both these medications were mentioned during Dr. Zain's talk. And usually, maybe you have already met your doctor to advise, but what we tend to do is usually that the morning medication goes to the evening. So you could take your Forxiga in the evening just after iftar, along with your Genumet. But whether you need the second Genumet, that is a question that you should ask yourself, depending on your control and previous experience during Ramadan. And if it does need adjustment, then the best thing is to see your doctor. The rule of thumb or the general advice is that whatever treatments you're taking in the morning during the daytime goes to the iftar time, and the evening medication goes to the suhoor time.
Okay, thank you so much for that, Dr. Zia. As Dr. Zain mentioned before, it's always best to have a personalized approach and to consult with your doctor, because every case is individual. So it's definitely worth having a chat with your doctor before changing any medications by yourself. I think that's all the questions that we have for today. Thank you so much for attending this webinar. We hope you found it useful. The presentation and the recording is going to be available on our YouTube channel. So if you want to have a look at that, if you want to save that. And we hope we've answered all your questions and it's been useful for you. Thank you so much.
Thank you.